Hello. All right, so today we are going to do a wound dressing. So to start off, I would check the provider's orders. And then after that, I would come into the room, identify myself, identify the patient using 2 patient identifiers, and then I would double check the wristband to make sure. And then from there, I would ask the patient if they're comfortable, and then check if we needed any pain medicine from the provider's orders. After we have done all of that, we would ask the patient if they want everybody to stay in the room or if there's anybody who he wants in or out of the room. That way we provide the most privacy for our patient. And then after we've done all that, I'm gonna go ahead and I'm gonna clean off the table. That way, when I gather my equipment, this is as clean as possible and I'm able to use it. I'll go ahead and I'm going to throw it away, and then I'll gather all of my equipment needed. All right. Okay. So now that everything is gathered, I provide privacy with the curtain or by closing the door if needed. And now I'm going to go ahead and I'm going to raise the patient's bed up to promote proper body mechanics for myself, to keep myself safe. And then as I do this, I'm going to keep the bed rails up. That way, if anything were to happen, they wouldn't fall. There we go. All right, so now that I've done everything, I'm going to do hand hygiene again, and then I will get everything situated. So bring this closer, and then from there, I will lower this. I'm gonna put my gloves on first before I lower. All right, lowering everything. And now I can no longer step away from my patient without being by the side. And now I'll go ahead and I will expose the patient's wound, but making sure just the wound in the dressing. We don't really want to try to harm any sort of privacy that they may want. Okay, so now we have our bandage exposed, so we're gonna go ahead and take that off. I will use my alcohol swab to take off this. That way it just kind of helps promote skin integrity or tissue integrity. And it's not going to be so harmful on the skin. So I would go around the border, just making sure to get the alcohol swab on there to help. All the way around the border. Okay, now that I have my wound, or the dressing, I would look at the dressing. It's sanguineous and about 25% covered of the 5x8 dressing. From here, if I needed to, or I would also look at or sense if there was any foul odor smell. Letting the patient know that this is what we expected after this post-surgery. And then I would also show the patient, that way if the patient is going to take care of the dressing themselves, then I would go ahead and show them, that way they understand what to expect and maybe what not to expect. So show the patient, and then inspect for any signs of infection such as edema, redness, temperature, so hot to the touch, and pain, which would be the most prevalent here. From here, I would go ahead and I would toss this into the biohazard bag. For right now, I'm just going to set it to the side. And now, since I have done that, I'm going to take my gloves off and toss them, because now they're dirty. And now I'm going to go ahead and do hand hygiene as well. Making sure to dry thoroughly. And now I will go ahead and put my gloves on. All right. So now we're going to go ahead and we are going to clean the wound. So I'm going to take my first thing of gauze, and I'm going to use the gauze cleaner, or the wound cleaner, sorry, And I'm going to spray it right on to my gauze. From here, I will go right down the middle, being careful that I'm not pressing too hard, just enough to clean the wound and any drainage that may be around. And I'm going to go ahead and toss that as well. I'm going to get another gauze. And now when I do my second one, I'm going to go more around the wound. I want to make sure that when I do my gauze, I go from the incision out rather than out to the incision. That way we're going from clean, or now it's cleanest to dirtiest. So again, not touching where I just did, but going more around. And then I would toss this, and then I would just use my gauze appropriately. If there was any more, I would go ahead and clean it off. Again, throwing in the appropriate bin. So everything is clean. So now I would go ahead and I would measure the wound. I don't have